Nearly half of every dementia diagnosis on the planet didn't have to happen. Not a small slice. Not a rare exception. Close to half. And here's the part that should genuinely unsettle you. Most people whose brains are already quietly declining have zero idea it's happening to them right now. A major 2024 report from leading dementia researchers pinpointed 14 factors in daily life that, if addressed, could prevent close to 45% of all global dementia cases. 14. That means there are 14 separate moments where your future brain health could go a completely different direction than it's currently headed. In this video, we're breaking down every single one, what they actually are, how they quietly damage your brain over time, and what you can realistically start doing about each one today. If straightforward, science-backed health content is why you're here, do me a favor and hit subscribe. It genuinely helps this channel reach more people who need to hear this. Let's start with the risk factor almost nobody sees coming, hearing loss. Most people treat hearing loss like a minor inconvenience, something you just get used to. But research from recent years tells a very different story. Untreated hearing loss can raise your dementia risk by 50% or more, from one overlooked issue alone. Here's the mechanism behind that number. Your brain isn't static. It depends on constant input to stay wired and strong. Neural pathways stay active only when signals keep flowing through them. When your hearing narrows, the conversations, the music, the everyday background noise of life all start fading, and entire regions of your brain begin receiving less stimulation. The brain follows one unforgiving rule. What stops being used starts to shrink. There's a second, sneakier mechanism at play too. When hearing becomes a struggle, people quietly start withdrawing from conversation. It's exhausting and sometimes embarrassing to constantly ask people to repeat themselves. So they go out less. They call less. And social isolation, which we'll come back to later, is its own independent dementia risk factor. One issue triggers the next, and doctors see this pattern constantly. A patient slowly disengages socially. Family assumes it's just aging, and years pass before anyone connects the dots back to untreated hearing. A hearing aid isn't a mark of getting old. It's a tool that actively protects your brain. If you've noticed your hearing slipping, or someone close to you has, that's worth a conversation with a specialist sooner rather than later. The exact same logic applies to your eyes. Vision provides roughly 80% of all the sensory information your brain takes in. 80%. When eyesight declines, your brain starts starving for input in almost the same way it does with hearing loss. Here's a number worth remembering: getting cataract surgery in a timely manner, removing that clouded lens that makes the world look foggy, has been shown to lower dementia risk by 29%, nearly a third. That's not a minor statistic. It's a direct, measurable link between restoring clear visual input and protecting long-term brain function. Your eyes and your brain are part of one connected system, even though almost nobody thinks of them that way. Cataracts develop so gradually that people simply adapt to seeing worse and assume it's normal. It isn't. It's treatable. Regular eye exams, and actually acting on what they find, matter far more than most people realize. And that brings us to something even more overlooked than your senses: what happens in your brain while you sleep. Because it turns out your nightly rest isn't just recovery. It might be the single most important repair process your brain performs. And most people are sabotaging it without knowing. There's a myth I hear constantly, and it needs to be addressed head on. I sleep badly. I wake up early. I toss and turn all night. But that's just what happens when you get older. No. Poor sleep is not a normal, unavoidable feature of aging. It's a fixable problem at any age, and what's happening inside your brain each night is far more important than most people realize. During deep sleep specifically, your brain activates something researchers call the glymphatic system, essentially the brain's overnight cleaning crew. This system flushes out metabolic waste that builds up in brain tissue throughout the day. Among that waste are two specific proteins, tau and amyloid. These are the exact same proteins whose abnormal buildup defines Alzheimer's disease under a microscope. The glymphatic system's entire job is preventing that buildup, and it can only do that job while you're asleep. When sleep is cut short or poor in quality, that cleanup doesn't finish. The toxic proteins linger, and every disrupted night adds a little more to the pile. Studies on living human subjects, not just animal models, have shown that even a single sleepless night measurably disrupts tau and amyloid processing. One night. Now picture someone who slept poorly for a decade straight. Their brain hasn't been properly cleared in years. When cognitive decline shows up decades later, Almost nobody traces it back to the sleepless nights from their 40s and 50s. But the connection is real. You already know what one bad night does to your thinking. The heavy head, the slower words, the short temper. That's not just tiredness. That's your brain telling you the cleaning cycle never finished. Then there's the phone before bed problem. Blue light from screens hits a brain structure called the suprachiasmatic nucleus, your internal body clock that governs when you feel alert versus sleepy. Blue light tricks that clock into thinking it's still daytime, so your brain suppresses melatonin, the hormone that triggers sleep onset. No melatonin, no smooth drop into rest. On top of that, doom scrolling, anxiety-inducing content before bed triggers a stress response. Cortisol rises, your nervous system shifts into alert mode, and instead of winding down, your brain enters threat analysis mode. This fuels rumination, a mental loop replaying the same worries over and over. And that loop doesn't stop just because your eyes are shut. So what actually helps? Put the phone away 45 to 60 minutes before bed. Try progressive muscle relaxation, slowly releasing tension from your face down to your feet. And try breathing with a longer exhale. Inhale for 4 counts, exhale for 8. A longer exhale activates your parasympathetic nervous system, the rest and calm mode. Start by unclenching your jaw, releasing tension in your cheeks, letting your tongue drop from the roof of your mouth. The rest of your body tends to follow. If insomnia with anxiety is a recurring pattern for you, it's genuinely worth raising with a doctor rather than just living with it. Now let's talk about something almost nobody connects to brain health, your muscles. Starting around age 30 to 35, your body naturally begins losing muscle mass. After 50, that loss accelerates to somewhere between 1 and 2% per year. By 80, some people have lost up to half their peak muscle tissue. Most people link this to strength or appearance. Almost nobody links it to their brain, but they should. Muscles function as an endocrine organ. They release hormone-like signaling molecules called myokines, which directly influence brain function, stimulate new neuron growth, and regulate inflammation throughout the body. Less muscle means fewer myokines, reduced blood flow to the brain, and higher baseline inflammation systemically. A 2025 study confirmed that age-related muscle loss is a genuine causal factor in cognitive decline, and that physical activity is the direct link driving that relationship. In plain terms, your muscles actively protect your brain. Losing them works against it. Here's the good news about muscle loss. Reversing its effects doesn't require a gym membership or hours of your day. Just 10 minutes of movement each morning, or 2 30-minute brisk walks a week, is enough to meaningfully lower cognitive decline risk according to the research. The key isn't intensity, it's regularity. One intense workout a month does far less than a short walk every single day. No equipment, no special location required, just consistency. Now let's talk about a warning sign most people completely misread: balance. A little unsteadiness while walking often gets blamed on blood pressure or circulation issues. But balance is actually controlled in part by the cerebellum and the frontal lobes, the same brain regions responsible for planning and coordination. And these are areas that tend to show early changes before cognitive decline becomes obvious elsewhere. Impaired balance and declining brain function often move together, and that connection is well established in neurology research. Try this simple test. Stand near a wall or chair for safety, lift 1 foot off the ground, and hold it for 10 seconds. Switch feet. If you can't hold steady on either side, that's a signal worth paying attention to. The good news is that your balance system responds well to training. Simple at-home exercises can produce measurable improvement within just a few weeks. But the hardest changes to catch are the ones happening entirely out of sight. Visceral fat. This isn't the fat you can pinch under your skin. It's the fat packed deep around your internal organs. Your liver, intestines, pancreas. From the outside, someone might just look a bit heavier or carry extra weight around the middle. But internally, this fat is metabolically active in a damaging way. It continuously releases inflammatory molecules, creating what researchers call chronic low-grade inflammation, a slow, silent process with no fever, no pain, and no obvious symptoms. Over years, though, it quietly damages blood vessels and nerve cells, including neurons in the brain. Visceral fat also drives insulin resistance, a state where your cells stop responding properly to insulin. And insulin isn't just about blood sugar. It plays a direct role in protecting neurons and regulating communication between brain cells. When insulin resistance sets in, your brain feels the effects too. Some researchers have gone as far as calling Alzheimer's type 3 diabetes because the metabolic connection is that strong. The 2024 Dementia Risk Report added high LDL cholesterol, the bad cholesterol, to the official list of modifiable risk factors for the very first time. So checking your waistline and getting your cholesterol tested isn't about how you look. It's about what your brain will look like 20 years from now. Now let's shift to something even more personal. The early warning signs to watch for in yourself or in the people you love. Speech is one of the earliest, most reliable markers of cognitive change. When neurodegeneration begins, language quietly simplifies, often before the person themselves even notices. Words that used to come instantly now require a pause. Sentences shorten. Complex phrasing fades. There's a well-documented pattern where someone's vocabulary narrows gradually over months, while the people around them simply adjust without registering it as a real change. If you or someone close to you has been taking longer to find words, trailing off mid-sentence, or speaking in noticeably simpler terms than a year ago, that's worth bringing up with a neurologist. Memory lapses come next. But here's the crucial part. It matters which kind. Walking into a room and forgetting why you went in there? That happens to everyone, at every age. But regularly forgetting what you said just 5 minutes ago, consistently losing the names of people you know well, or confusing the order of recent events, that's a different category entirely. Clinically, these early-stage changes are called mild cognitive impairment or subjective cognitive decline. Neither one is dementia. But both represent the window where intervention has the strongest chance of making a real difference. Then there's spatial navigation. And this one is easy to overlook because technology has quietly replaced it. GPS has taken over one of the most demanding tasks your brain used to handle constantly. The hippocampus, the brain structure most heavily and earliest affected by Alzheimer's, is deeply involved in spatial memory and navigation. When you always outsource direction finding to your phone, that part of your brain simply stops getting exercised. Try this. Next time you're heading somewhere familiar, leave the GPS off and navigate from memory instead. This isn't nostalgia for the old days. It's deliberate training for a brain region worth protecting. If you want an objective read on where your cognitive function currently stands, there's a self-administered assessment tool available online that you can complete from home and interpret yourself. It's a useful starting point for deciding whether a neurology appointment makes sense right now, though it's not a substitute for a specialist trained to catch subtler changes. So what can you actually do, starting today, to protect your brain? Move every day, even if it's just 10 minutes. Physical activity stimulates the growth of new brain cells, strengthens blood flow to the brain, and the myokines released by working muscles directly support neural health. Brains in sedentary bodies shrink faster. That's not a scare tactic. It's documented in brain imaging research. Protect your social connections. One of the longest-running studies in medical history, spanning nearly 80 years, found that the quality of your relationships is among the strongest predictors of long-term brain health and lifespan. Not the number of contacts in your phone. The depth, warmth, and regularity of real human connection. People with rich social lives preserve cognitive function significantly longer. Debate ideas with people. Go to a show. Have real, unhurried conversations. All of it counts as exercise for your brain. Keep learning at any age. Low educational engagement raises dementia risk by 1.6 times. But this isn't about degrees or diplomas. It's about whether you keep learning throughout life. Your brain retains neuroplasticity, the ability to build new connections in response to new experiences, well into old age. Learning a second language, picking up an instrument, reading demanding literature all count. One study found that reading serious fiction for just 2 months produced measurable, positive structural changes in the brain. Not passive scrolling. Content that actually demands attention, empathy, and analysis. Read aloud when you can. It activates multiple brain regions at once. Write by hand. Fine motor activities like writing, drawing, or knitting stimulate large areas of the motor cortex. This isn't just a hobby. It's active brain protection. Let's talk about emotional health, because depression isn't a personality trait or a passing phase. It's a medical condition, and it raises dementia risk by 2.2 times. The mechanism is well understood at this point. Depression raises inflammatory markers in both the blood and the brain, disrupts the growth of new neurons, and measurably shrinks the volume of the hippocampus. Depression and cognitive decline feed each other in a loop. Leaving depression untreated damages both your emotional life and your cognitive future at the same time. Persistent low mood, losing interest in things you used to enjoy, chronic fatigue, disrupted sleep. These are all worth bringing to a healthcare provider. Depression is treatable, and treating it early genuinely protects the brain. Now, 2 habits worth being honest about: smoking and alcohol. Smoking raises dementia risk by 1.2 times. Alcohol raises it by 1.3 times. And I want to spend a moment specifically on alcohol, because one of the most persistent myths in health culture is still circulating everywhere. That a glass of red wine before bed is good for your heart. That a little something strong is practically medicinal. It isn't medicine. It's a narrative that's been remarkably effective at sticking around in public consciousness. The current evidence-based medical consensus is unambiguous. There is no truly safe dose of alcohol. Every amount causes some degree of harm. The only real question is how much and how fast. For the brain specifically, regular drinking, even at moderate levels, accelerates tissue loss over time and disrupts the very sleep architecture that the brain's overnight cleaning system depends on. So that nightly glass meant to help you relax is, in reality, working against your brain twice over. There's a well-documented case from clinical neurology that shows exactly how these factors compound. A man in his late 50s came in with mild word-finding trouble and occasional disorientation while driving routes he'd known for years. He slept poorly, had a sedentary desk job, drank 2 glasses of wine most nights, and had untreated mild hearing loss. Each factor on its own seemed manageable. Together, they'd been quietly stacking for years. When his neurologist addressed just 3 of these factors at once, his cognitive function measurably stabilized within 18 months. Not reversed. Stabilized. But that's exactly the point. Early action changes the trajectory, and timing really does matter more than most people think. After 40, age-related brain changes start accelerating. After 50, dementia risk roughly doubles every 5 years. The earlier you start addressing these factors, the stronger the protective effect becomes. So here's the full picture, brought together. Get your hearing and vision checked, and act on what you find. Don't wait. Fix your sleep, keep the phone out of the bedroom, and take chronic insomnia seriously. Move every day, even if it's just 10 minutes. Watch your waistline and get your cholesterol checked. Stay socially engaged, keep learning, and read real books that demand your attention. Take your emotional health seriously. Depression is treatable, not just something to push through. Cut back on smoking and alcohol. And if you've noticed real changes in your speech, memory, or sense of direction, don't wait. Bring it to a neurologist. Early is always better than late. Almost half of dementia cases are preventable. And now you know exactly where that 45% comes from and what you can actually do about it. If this gave you something worth acting on, don't keep it to yourself. Subscribe to the channel, drop a comment with one change you're making starting today, and share this with someone in your life who needs to hear it too. Your brain's future is being shaped by the choices you make right now. Start with just one.